Good evening. This is All India Radio. I'm Arjun Chaudhary and with me is Ramaswamy Subramaniam Raghu with the evening news. In the top headlines, administration of precautionary dose of COVID-19 vaccine for eligible people begins in the country. Centre asks states and union territories to ramp up health infrastructure to effectively deal with rising COVID cases. Health Minister Dr. Mansukh Mandavia reviews the public health preparedness for COVID-19 and national vaccination progress with 6 western states and union territories. 4,033 cases of Omicron variant reported in the country so far. Delhi government closes restaurants and bars for dine-in, allows takeaway facilities only. A high-level committee to be set up by the Supreme Court to inquire into security lapses during Prime Minister's Punjab visit. Second quarter report of quarterly employment survey released. Total employment in 9 select sectors stands at 3 crore and 10 lakh. Visually challenged students soon to have access to user-friendly, durable braille maps using advanced technology. And in cricket, third and final test between India and South Africa to begin at Cape Town tomorrow. And before the news in detail, let's hear the public service announcement. As the number of COVID-19 cases are rising fast in several parts of the country, we appeal to our listeners to be vigilant and to get fully vaccinated and help others, including children between 15 and 18 years, get vaccinated. As the new Omicron variant of coronavirus is causing concern, please continue to follow the 3 simple steps to stay safe. Wear a face mask, maintain 2 gaz ki duri for social distancing, and focus on hand and face hygiene. For any COVID-related information and guidance, contact the national helpline numbers 011 2397 8046 and 1075. And now the news in detail. Administration of precautionary dose of COVID-19 vaccine for healthcare and frontline workers and those over 60 years of age with comorbidities began across the country today. The centre has issued guidelines stating that no new registration will be required to get a precaution dose. The CoWIN system will send SMS to such beneficiaries for availing the precaution dose when the dose becomes due. Union Health Minister Dr. Mansukh Mandavia has said that reminder messages have been sent to more than 1 crore people eligible to receive precaution doses. Prioritization and sequencing of the precaution dose for the beneficiaries would be based on the completion of 9 months from the date of administration of the second dose, which is 39 weeks. The precaution dose will be the same vaccine as were given to them previously. Talking to AIR News, in charge of COVID Vaccination Centre at RML Hospital, New Delhi, Dr. Neelam Roy said that an overwhelming response is being seen among the people for receiving the precaution dose.
We have 3 vaccination sites and we have 20% slots. In all the 3 sites, they are reserved for precaution dose. Those who have completed 9 months after the second dose, they are eligible for precaution dose, including healthcare workers, frontline workers and 60 years and above with comorbidities. And all the online slots, they are already booked at all the sites of RML Hospital. And also we are giving the same vaccine as per guidelines. The vaccine has to be same for precaution dose as given in first and second. We have 3 vaccination sites and we have 20% slots. In all the 3 sites, they are reserved for precaution dose. Those who have completed 9 months after the second dose, they are eligible for precaution dose, including healthcare workers, frontline workers and 60 years and above with comorbidities. And all the online slots, they are already booked at all the sites of RML Hospital. And also we are giving the same vaccine as per guidelines. The vaccine has to be same for precaution dose as given in first and second dose.
Like other parts of the country, administration of precaution doses of COVID-19 vaccine for healthcare and frontline workers and senior citizens with comorbidities also began in Samba district of Jammu and Kashmir. In Samba district, the precautionary vaccination for frontline workers and healthcare was started at 20 designated vaccination sites across the district. Talking to AIR News, the Corona Warriors, health workers who took the precautionary dose at the Government District Hospital Samba, expressed their views.
मेरा नाम सतपाल है फ्रंट लाइन वर्कर हूँ। मुझे ऑलरेडी पहले 2 डोज लगी है, आज मेरी तीसरी डोज है और मैं गवर्नमेंट का बहुत बहुत आभारी हूँ जिन्होंने सबसे पहले जो हॉस्पिटल का स्टाफ है उनको आगे रखा हुआ है। इस बार हमको तीसरी डोज लगी है, हम लोगों ने कोरोना को हराना है।
मैं डॉक्टर श्वेता भगत डिस्ट्रिक्ट हॉस्पिटल सांबा में कार्यरत हूँ। आज हमें कोविड की तीसरी वैक्सीनेशन लगी है। पहली डोज जब लगी थी तब मन में हमारे थोड़ा डर था, लेकिन दूसरी डोज लगने के बाद बिल्कुल डर निकल गया और तीसरी डोज ये एक प्रिकॉशनरी वैक्सीन जो हमें लग रही है, हम सरकार का धन्यवाद करते हैं कि उन्होंने हमें ये अपॉर्चुनिटी दी। सभी लोगों को आगे आकर थर्ड डोज लगानी चाहिए।
The central government has asked the states and union territories to take adequate steps to ramp up the health infrastructure and deployment of healthcare workers to effectively deal with the rising COVID-19 cases. In a letter written to all the states and union territories today, Union Health Secretary Rajesh Bhushan asked the states and UTs to earmark different categories of beds in private clinical establishment for COVID care. The states and UT administrations have also been asked to ensure that the charges levied by such health facilities must be reasonable. The centre has also urged to upgrade COVID care centres' beds to oxygen-supported beds. States has also been asked to engage retired medical professionals or MBBS students for providing teleconsultation services and skilling of community volunteers in basic care and management at COVID care centres. It has been requested that all district hospitals and medical college hospitals at district headquarter level to be utilized as e-Sanjeevani teleconsultation hub for providing e-OPD and teleconsultation to patients. Union Health and Family Welfare Minister Dr. Mansukh Mandviya today reviewed public health preparedness and national COVID-19 vaccination progress with 6 western states and union territories. These states and UTs are Maharashtra, Madhya Pradesh, Rajasthan, Gujarat, Goa, Dadra and Nagar Haveli, and Daman and Diu. During the meeting, states and UTs were advised to undertake regular review of health infrastructure, establish teleconsultation hubs in every district, and focus on widespread awareness regarding healthcare services. While reiterating on the importance of test, track, treat, vaccinate and adherence to COVID-appropriate behavior, Dr. Mandviya said holistic synergy between the centre and states is most vital for seamless and effective pandemic management. He said the centre has provided support under India COVID-19 Emergency Response and Health System Preparedness Package Phase 2 for strengthening the health infrastructure across the country. He urged the states to efficiently utilize the funds provided under the package. Dr. Mandviya also advised to review the buffer stock of essential medicines.
The Health Ministry has issued revised advisory for managing healthcare workers working in COVID and non-COVID areas of the healthcare facilities. In the guidelines, the ministry said that all health facilities shall activate its Hospital Infection Control Committee. The committee in the health facility is responsible for implementing the infection prevention and control activities and organizing regular trainings on infection prevention and control for healthcare workers. It said a nodal officer shall be identified by each health facility to address all matters related to healthcare-associated infections. A total of 4,033 cases of Omicron variant of COVID-19 have been reported in the country so far. Out of these, 1,552 patients have already recovered and migrated. Maximum number of 1,216 cases have been reported from Maharashtra, followed by Rajasthan with 529 and Delhi with 513 cases. Omicron cases have been reported in 27 states and union territories. Health and Family Welfare Ministry today said over 151 crore and 94 lakh doses of COVID vaccines have been administered in the country under the nationwide vaccination drive. The ministry said more than 29 lakh and 60,000 COVID vaccine doses were administered in the last 24 hours. The country reported over 1,79,000 new COVID cases and 46,569 COVID patients recovered during the same period. National recovery rate stands at 96.62%.
Lieutenant Governor Anil Baijal has said that Delhi's health department has been advised to make adequate arrangements for additional manpower in hospitals and to scale up the vaccination drive. He said Delhi's administration has also been advised to strictly ensure COVID-appropriate behavior in marketplaces and public areas to break the chain of transmission of COVID-19. Mr. Baijal today chaired the 31st meeting of Delhi Disaster Management Authority to review the COVID-19 situation in the national capital. The meeting was attended by Chief Minister Arvind Kejriwal, Deputy CM Manish Sisodia, Health Minister Satyendra Jain, Member Health Niti Aayog DG ICMR and Director AIIMS. Senior officials were also present during the meeting. After the meeting, Delhi's LG said in view of the increase in positive cases, it was decided to close the restaurants and bars and to allow takeaway facilities only. It was also decided to allow operation of only one weekly market per day per zone. Defence Minister Rajnath Singh has tested positive for COVID-19 today with mild symptoms. In a tweet, Mr. Singh said he is under home quarantine. He requested everyone who recently came into contact with him to isolate themselves and get tested.
The process of assembly polls for Uttar Pradesh is going to begin with the issuance of a notification on the 14th of this month. Uttar Pradesh will go to the polls in 7 phases from the 10th of February to the 7th of March. Polling for Punjab, Uttarakhand and Goa will be held on the 14th of February in a single phase. Manipur will vote on the 27th of February and the 3rd of March in 2 phases. The counting of votes will be taken up together on the 10th of March. A total of 690 assembly constituencies in Goa, Manipur, Punjab, Uttarakhand and Uttar Pradesh will go to the polls this time. Here is a report on the election preparation by the Commission in view of the prevailing COVID situation.
In view of prevailing COVID-19 pandemic and rising cases of Omicron variant across the country, Election Commission has laid focus on COVID-safe election with maximum participation. It is going to ensure the safety of vote and voters as both are equally and critically important in the democracy. All election officials and employees will be considered as frontline workers and all eligible officers will be vaccinated with precautionary dose. During the electoral campaign, no roadshow, padyatras, cycle or bike rallies and procession will be allowed till 15th of January. The Election Commission has also decided to increase the broadcast time allotted to recognized political parties on Doordarshan and All India Radio during these elections. The Election Commission has issued detailed instruction to the concerned Chief Electoral Officer to ensure that every polling station is equipped with assured minimum facilities. In view of pandemic, the Commission has also decided to extend the poll timing by 1 hour in all assembly constituencies. Manal Saeed, News Desk.
You are listening to the evening news on All India Radio. A reminder of the headlines before we move on. Administration of precautionary dose of COVID-19 vaccine for eligible people begins in the country. Centre asks states and union territories to ramp up health infrastructure to effectively deal with rising COVID cases. Health Minister Dr. Mansukh Mandviya reviews public health preparedness for COVID-19 and national vaccination progress with 6 western states and union territories. 4,033 cases of Omicron variant reported in the country so far. Delhi government closes restaurants and bars for dine-in, allows takeaway facilities only. A high-level committee to be set up by Supreme Court to inquire into security lapses during Prime Minister's Punjab visit. Second quarter report of quarterly employment survey released. Total employment in 9 select sectors stands at 3 crore 10 lakh. Visually challenged students soon to have access to user-friendly durable braille maps using advanced technology. And in cricket, third and final test between India and South Africa to begin at Cape Town tomorrow. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
अपने बिजनेस को बढ़ाने के लिए लीजिए आकाशवाणी का सहयोग और दीजिए उसे बुलंदियों के पंख।
आपका बिजनेस लोकल है या राष्ट्रीय, आकाशवाणी देती है उपभोक्ताओं तक पहुंचने का हर विकल्प।
और अब तो आप घर, दफ्तर या दुकान पर बैठे बैठे कर सकते हैं आकाशवाणी के किसी भी केंद्र के लिए विज्ञापनों की बुकिंग।
आकाशवाणी के विभिन्न चैनलों पर विज्ञापन देना सुलभ और सस्ता।
बुकिंग है तो संपर्क करें 8700014242 पर।
8700014242।
चलो मिलकर एक शुरुआत करें, चलो एक फैसला आज करें, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे, चलो एक इरादा करते हैं, चलो कुछ वादा करते हैं, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे।
Welcome back to the news. Prime Minister Narendra Modi will inaugurate the 25th National Youth Festival on the 12th of January at 11 a.m. in Puducherry via video conferencing. The day is observed as National Youth Day to commemorate the birth anniversary of Swami Vivekanand. The festival aims to shape the minds of India's youth and transform them into a united force for nation building. The Prime Minister will also inaugurate 11 new government medical colleges across Tamil Nadu and the new campus of Central Institute of Classical Tamil in Chennai. The new medical colleges are being established at an estimated cost of about 4,000 crore rupees. The Supreme Court will constitute a high-level committee headed by a retired Supreme Court judge to investigate lapses in Prime Minister Narendra Modi's security in Punjab. A three-judge bench comprising Chief Justice N.V. Ramana and Justices Surya Kant and Hima Kohli was hearing the plea filed by an organization, Lawyers' Voice. The Prime Minister's convoy was stranded on a flyover due to a blockade by protesters in Firozpur, after which he returned from pole-bound Punjab without attending the planned events, including a rally.
Labour and Employment Minister Bhupendra Yadav today released the report of second quarter of Quarterly Employment Survey. It is a part of All India Quarterly Establishment-Based Employment Survey. Sharing the results, Mr. Yadav said, employment is showing an increasing trend across various sectors and total employment in 9 selected sectors stands at 3 crore 10 lakh. He said employment figures are 2 lakh higher than the estimated employment of the first round of Quarterly Employment Survey. The minister emphasized that last mile delivery is the prime objective of the government. He said the ministry has entrusted nationwide surveys to the Labour Bureau for evidence-based policy making in order to achieve the objective. The report highlights that the manufacturing sector engages 39% education, 22% and health, 10% of the estimated workers. The overall percentage of female workers stood at 32.1%, which is nearly 3% higher than the percentage reported during the first round of the survey. The report further highlights that regular workers constitute 87% of the estimated workforce in the 9 selected sectors, with only 2% being casual workers. As our nation celebrates the 75th year of independence, a series of events are being organized by the government as a part of Azadi Ka Amrit Mahotsav. To commemorate the occasion as a Jan Utsav, All India Radio News brings its listeners a special quiz on India's freedom movement and its glorious history. The quiz is being conducted every Monday and Tuesday in the morning news. The next question of Amrit Mahotsav quiz will be shared with listeners tomorrow. And now, let's listen to our special program Azadi Ka Safar, highlighting the importance of the day during the freedom struggle.
Azadi Ka Amrit Mahotsav.
Azadi Ka Safar with AIR News. Birth of a Nation. India's glorious freedom struggle is one of the greatest struggles the modern world has ever witnessed. AIR News brings you a glimpse of this struggle every day.
On the 10th of January 1616, England's first official ambassador to India, Thomas Roe, came to the court of Mughal Emperor Jahangir at Ajmer. Although his 4-year-long negotiations with Jahangir didn't prove successful, the visit marked the beginning of British economic and political interest in the Indian subcontinent.
Roe arrived at the port of Surat in September 1615 with a letter from King James I to the then reigning Mughal Emperor Jahangir seeking a trade agreement. Determined that his arrival to the Mughal Empire should be an occasion of dignity and splendor, Roe did not leave the ship for a full week, mainly due to arguments over customs searches. He finally made the journey to Ajmer, where he was presented to the Emperor Jahangir on the 10th of January 1616. Roe was vexed to discover that the Mughals regarded relations with the English as a very low priority. On arrival, he was showed into a substandard accommodation.
Roe lived in the Mughal Empire until the 17th of February 1619, during which time he laboured to improve England's reputation among Mughal officials and tried desperately to obtain a royal farman for permanent trade. He eventually returned to England in 1619 without the trade agreement.
We also remember freedom fighter Narhari Vishnu Gadgil, who was born on the 10th of January 1896 in Malhargarh, Madhya Pradesh. Popularly known as Kaka Saheb Gadgil, he was an erudite lawyer and an outstanding literary figure. Gadgil was influenced by great freedom fighters including Lokmanya Bal Gangadhar Tilak, Mahatma Gandhi and Vallabhbhai Patel.
Spiritual leaders Swami Ramakrishna Paramhans and Swami Vivekananda also made a deep impression on him. For his active participation in the national freedom movement, he was imprisoned 8 times by the British.
Gadgil joined the Indian National Congress immediately after obtaining his law degree. He served as the secretary of Pune District Congress Committee in 1920. Later, he became the president of Maharashtra Pradesh Congress Committee. He was elected to the Central Legislative Assembly in 1934. Gadgil was a pioneer in social reform movements in Maharashtra in the 1930s.
After independence, Gadgil served as a minister in the first Central Cabinet of India between 1947 and 1952. He held the portfolios of public works and mines and power. He is credited with initiating the project of building a military-caliber road between Pathankot to Srinagar via Jammu and Kashmir as a part of strengthening India's hold over the region during and after the 1947 Indo-Pakistan War. He also initiated important development projects including Bhakra, Koyna and Hirakud dams. Gadgil also served as the governor of Punjab.
Gadgil was a prolific writer and wrote several books and articles on politics, economics, law, history, oratory, etc. His important works include Pathik and Rajya Shastra Vichar. For his great contribution to Marathi literature, he was elected president of the Marathi Sahitya Sammelan in 1962. He remained committed to the welfare of the public till his death on the 12th of January 1966.
That brings us to the end of this episode of Azadi Ka Safar with AIR News. See you in the next episode tomorrow.
भारत के स्वतंत्रता संग्राम में अनगिनत स्वतंत्रता सेनानियों ने अपने प्राणों की आहुति दी। कुछ इतिहास में अमर हो गए और कई गुमनाम। आजादी के अमृत महोत्सव के अंतर्गत 75 कड़ियों की श्रृंखला में हम उन वीरांगनाओं की बात करेंगे जिनका योगदान कभी भुलाया नहीं जा सकता। प्रत्येक मंगलवार परिक्रमा में सुनिए अपराजिता, देश की वीरांगनाओं को आकाशवाणी का सादर नमन।
Best wishes to all consumers for Azadi Ka Amrit Mahotsav. Hallmark ensures purity of gold. Always purchase hallmarked gold jewelry. For any consumer-related complaints, please contact National Consumer Helpline's toll-free number 14404. Issued in public interest by Department of Consumer Affairs, Government of India, Jago Grahak, Jago.
Welcome back to the news. Ministry of Science and Technology said that visually challenged students from all over the country will soon have access to braille maps designed and developed using digital embossing technology. It added, this technology is not only useful for high-speed production of the maps, but can also produce braille maps that can be used by more people for years together. The ministry said the technology has been introduced, designed and implemented for the first time in India by National Atlas and Thematic Mapping Organization. It is functioning as the attached office of the Department of Science and Technology. In sports, in cricket, the third and final test between India and South Africa will begin at Cape Town tomorrow. During a pre-match press conference today, Indian captain Virat Kohli said he will return to the team for the series deciding third test match as he is absolutely fit. He had missed the second test because of an upper back spasm. Virat added that Mohammad Siraj will not participate in the game as the pacer suffered a hamstring injury in the Johannesburg test match. The three-match test series is evenly poised with both teams winning a match each.
World number one tennis player Novak Djokovic has won a court battle to stay in Australia to contest the Australian Open despite being unvaccinated against COVID-19. But the government has threatened to cancel his visa for the second time. Federal Circuit Court Judge Anthony Kelly has quashed the visa cancellation and ordered the Australian government to pay legal costs and release Djokovic from detention. But the Australian government's counsel, Christopher Tran, has revealed the immigration minister will consider exercising a personal power to cancel Djokovic's visa. This would mean Djokovic is not guaranteed to stay and compete in the Australian Open. The Australian Open will start from Monday, January the 17th.
World Hindi Day is being observed today. The day is observed every year with the objective to promote use of the Hindi language abroad. On this day in 2006, the first World Hindi Conference was held in Nagpur with the aim to promote the language worldwide. Ministry of External Affairs celebrated the World Hindi Day program in virtual mode today. In a video message, Prime Minister Narendra Modi said that Hindi plays an important role in the communication of Indian knowledge and culture. He said the increasing use of Hindi in the field of information and its popularity among the youth presents a bright future. In his message, External Affairs Minister Dr. S. Jaishankar said they are constantly moving towards the goal of taking Hindi on the global stage. The program was presided over by Minister of State for External Affairs, Meenakshi Lekhi. She cited the various steps taken by the ministry to promote the study of Hindi in foreign countries.
In Ladakh, after the recent heavy snowfall, Mechanical Division Kargil has launched road clearance operation to clear all links roads and major roads of Kargil district. People appreciated the on-time clearance of roads, particularly Kargil to Parkachik Road, Sanku Basu and adjoining roads and internal roads of Dras area. Meanwhile, Municipal Committee Kargil also cleared snow from roads in and around Kargil town, and MC workers were seen soiling the roads at slippery areas, making the way easy for vehicles. In Spotlight, the News Services Division of All India Radio will bring tonight an exclusive interview with Secretary Youth Affairs Usha Sharma. This can be heard on FM Gold channel and additional frequencies from 9:15 p.m. onwards. This program will also be available on our website newsonair.gov.in and on our YouTube channel News on AIR Official.
Devotees at the Kashi Vishwanath temple will no longer need to enter the temple premises barefoot. They will wear disposable Khadi handmade paper slippers from the 14th of this month. Khadi and Village Industries Commission will begin the sale of Khadi slippers from the Khadi sales outlet located at the parking lot of the Kashi Vishwanath corridor. These can be purchased at the price of 50 rupees per pair. The development comes in the wake of the jute slippers sent by Prime Minister Narendra Modi for the workers of Kashi Vishwanath temple after he learned that most of the people working at the temple performed their duty barefoot. It is forbidden to wear footwear made of leather or rubber on the temple premises. And now, before we end the bulletin, the headlines once again. Administration of precautionary dose of COVID-19 vaccine for eligible people begins in the country. Centre asks states and union territories to ramp up health infrastructure to effectively deal with rising COVID cases. Health Minister Dr. Mansukh Mandavia reviews the public health preparedness for COVID-19 and national vaccination progress with 6 western states and union territories. 4,033 cases of Omicron variant reported in the country so far. Delhi government closes restaurants and bars for dine-in, allows takeaway facilities only. A high-level committee to be set up by the Supreme Court to inquire into security lapses during the Prime Minister's Punjab visit. Second quarter report of quarterly employment survey released. Total employment in 9 select sectors stands at 3 crore and 10 lakh. Visually challenged students soon to have access to user-friendly, durable braille maps using advanced technology. In cricket, third and final test between India and South Africa to begin in Cape Town tomorrow. And for details of these stories and more, log on to our website www.newsonair.gov.in and News on Air app. And with that, we end the evening news. Good night.